Hi guys, good afternoon. How's everyone doing today? I hope you guys are having an amazing day. Today we have our lovely Dr. Porter. So today we're gonna be asking her some questions, you guys, and as you know, you can always ask whatever question it is, whatever doubt you may be having. We're always here to help you guys and to cater to your needs and your wants. Okay, so we're gonna go ahead and start with our questions. Okay, welcome. I see a couple of people have joined the live now. Welcome, guys. So, does the use of Cell Saver affect recovery time?
So Cell Saver is taking from when we do liposuction, the blood loss, if there is any. It can take back that aspirate that comes with the lipo, and if there's red blood cells in there, it can give it back to you. So it does help with the fluid status and the a hemoglobin level and stuff. So yeah, it does help with recovery time.
Great. Welcome. I see lots of people are joining. Welcome, you guys. Whatever questions you may have, you could go ahead and put them in the chat. If you would like to schedule a free virtual consultation or a free in-person consultation with Dr. Porter, all you guys need to do is leave your information right here in my left bottom corner in this blue folder. Okay, you guys, you see right here on her left leg right here. Okay, guys? So, the next question we have is, how soon will I see results after a J-plasma procedure?
So J-plasma takes a long time to see results. I mean, from anything like the lipo or J-plasma, particularly with lipo, you see the lipo effects, kind of right away at first, and then you swell up for a month. And then, some people get a little discouraged during that month because sometimes I look bigger than I did before, but it's just swelling. And then the J-plasma actually, it takes up to 5 months to contract the skin. So you have to be patient.
Patience is key, you guys, okay? Is J-plasma good for all skin types and areas?
So areas, sure. Skin type, it gives you about 50 to 60% skin contraction. So if you're kind of in the middle of maybe you're gonna have a little bit of loose skin, that's kind of where it's the sweet spot for it. Or if you are just looking for that extra skin contraction with lipo, if you definitely need a tummy tuck and you have a lot of stretch marks and stuff, then that J-plasma probably isn't gonna do a lot for you. But I have seen, I have been surprised by some people.
Amazing. How does a skinny BBL differ in technique from a standard BBL?
So just this skinny BBL is just people looking, that are smaller, just looking for some volume. I don't really treat it much differently. Kind of every BBL to me is less about standard BBL versus skinny. It's more so looking at your body and what's gonna fit you better. Sometimes people want specific things, but especially if you show us what you're thinking of, just so that we can say yes, that's possible, no, that's not possible. So
what is the recovery like after breast augmentation?
So for about 3 weeks, well, for 6 weeks, no heavy lifting when 15 pounds. For 3 weeks, you really can't lift your arms above your head. And then, so if you're brushing your hair like this, and then you are sore because, especially if we put them under the muscle. For a few days, it kind of feels like there's something pressing on your chest. But it's pretty quick. It's just, the arm restrictions and then the lifting restrictions.
Would you say right after surgery, would I be able to have my phone like this?
Yeah.
Yeah, right? Yeah, because the phone is not that heavy. Okay. Is it true that I need to self-massage my implants after surgery?
Yes. So starting a few days after surgery, you just start massaging the implants up and down and side to side. At first, you're probably not going to be why am I doing this? But then as they start to settle and, as time goes on, 6 months, 9 months, they're going to be mobile. So they'll go up, down, and side to side. If they're not doing that, then you need to reach out to your doctor.
Who is a good candidate for breast reduction surgery?
anybody who thinks that their breasts are too large and have like ptosis of the nipple. Ptosis means that the nipple is like decreased from the position that it naturally once was, but just more so for large breast tissue. Some women probably have a size that a lot of people want to be, but you know, they just find them cumbersome. They need breast reduction. And then there's like the classic stereotypical like very large pendulous breasts that want a breast reduction.
Of course. Will insurance cover my breast reduction if it causes any like back pain or any like sort of health problems?
So there are ways to get breast reduction covered by insurance. It does take a very long time.
So you might as well start now, you guys, if this is your case. Can arm liposuction get rid of bat wings or sagging skin?
Not lipo. So lipo, by definition, it removes fat. Sometimes you get the added benefit, depending on your skin quality or skin type, that there will be like skin, you know, contraction. That's not always the case though. If you have extra skin, then you need a brachioplasty.
How is the healing process for arm lipo?
So people complain about arm lipo and thigh lipo, just that it's sore for the first few days, or I guess more sore than they expected. It's the same healing process with any lipo. You wear a garment, you know, for a few months, and then massages. You know, you can self-massage or get like a manual massage, yeah. But you just want to make sure that you are moving, because with any lipo you get fibrosis, and you're going to notice it a lot more on something that you're constantly moving than you would like your abdomen or your back.
Of course. And would you say that there's like a specific amount of massages for arm lipo?
I don't ever recommend a specific amount of massages because it's money out of someone's pocket.
The more the better, right?
Yeah. Just, or if you know you can't, then self-massaging, or with like, they have stuff on, you know, Amazon and stuff that you can use.
Of course. So, can a breast reduction be combined with a lift or liposuction?
Yes. With like a breast reduction, actually it's a lift. So we would never reduce them and leave them in the same place. You know, when we're reducing them, we're lifting them to where they should be. We just, instead of, you know, a lot of lifts, we do take out a little bit of tissue, but a true reduction, you're taking out like a larger chunk of breast tissue as well as skin. But yeah, you get the same. And then for lipo, not so much of the breast, but sometimes women have like here or like the sides, they have a little bit of extra fat. We can absolutely do lipo, or armpit lipo. Yeah.
Oh yeah, I actually wanted to ask you about that. I received a question in our previous live, like how does the armpit lipo work? Because I have an understanding that it's like the little chunk of skin that we have right here.
Yeah, so some of it is skin, some of it is breast tissue. Yeah. So, or not skin, sorry, fat. So as you get older, you have a ligament, and as you get older, that ligament relaxes, but your axillary tail of your breast goes all the way up here. That's why with breast cancer, breast screening, you know, they're always checking the armpits too. So sometimes it is just fat, and you can try lipoing it, and if it gets better, then, you know, it's fat. Sometimes it's breast tissue, and that needs to be surgically excised.
Oh wow, amazing. How does breast fat transfer compare to implants in terms of longevity? Am I saying it right? And feel. So long day today, you guys.
Fat transfer adds volume. Keep in mind though, like your butt, it's kind of different. Fat transfer, the mechanism is the same, but like the fat transfer to the buttock is usually in like a tighter space, or you know, it holds pretty nicely from what we've seen, you know, and then fat transfer to the breast to begin with, unless it's like very small breast, like perky, it'll add volume, but any weight that you add to the breast can cause sagging. So at first, fat transfer tends to look very good, and then over time, you will have larger like a larger cup size. You can usually go up by like half a cup to 1 cup size, but the like shape of the breast and like where the nipple is and everything, it's gonna stay the same. That being said, with an implant, we're not exactly changing. If we're just putting in augmentation, you're not changing where the nipple is or anything, but you are kind of changing the shape of the breast because you're putting that implant in there, and it's causing like more volume, it's more structured. So fat has no structure to it. An implant is structured. It's designed to kind of look like a teardrop when it settles, and it's going to add like more defined cleavage and stuff. The fat transfer is just going to add volume.
Of course. So there you guys have it. You can either pick and choose what it is that you're looking forward to, and here at Icon Cosmetic Center, we're always going to deliver your goal, okay? Especially with Dr. Porter, you guys. So, what is the difference between Lipo 360 from traditional liposuction? I think this is like a question where people tend to get confused with the name Lipo 360 in case of just like liposuction.
It's the same thing. So 360 just means that we're doing the front, like the abdomen, the sides, and the back, not the like upper back by like the neck or anything, but like kind of like from your armpits down. It's same technique and everything like that. You don't always have to get lipo 360. You can just get lipo of the back or lipo of the abdomen too.
So we have a question here from Good Laughter. Welcome, how are you doing today? For massive weight loss patients, would you recommend a lower body lift before BBL?
So this is tricky. I mean, everybody has, their individual results with their weight loss journey. A few things. So a lot of times massive weight loss patients, and especially now, I've seen a lot of people that have had weight loss surgery and they're on like Ozempic or Mounjaro. They have no fat. So I don't know where you think we're gonna get the fat from for a fat transfer. And then, it's a lot of just extra skin. Massive weight loss patients, it's kind of tricky sometimes because it's not something that can be done in one stage. There are multiple procedures that need to be done depending on what you want. If you just want a flat stomach, then a tummy tuck, but a lot of times you need like the fleur-de-lis, the vertical and the horizontal incision, because it's just a lot of, you lose weight so rapidly, and especially with the combination of these GLP-1 inhibitors, that your body doesn't have enough time your skin doesn't have enough time to catch up with the weight loss. So another thing, fat transfer adds weight. So same thing like with the breast, if your skin quality is not great and you have a lot of loose skin, the fat is not, it can fill it up a little bit, but it's adding more weight to cause more skin sagging. So if you want to try BBL, that's fine. I think that, yeah, a lot of times you need a lower body lift, because again, if we lipo and a lot of times there's like loose skin at the top, it kind of creates like a lip and then the fat transfer.
Okay, amazing. What's the recovery time for inner thigh lipo, and how do you maintain results?
Same as any lipo. So the recovery time, your legs are going to be a little bit sore. There's some drainage, like with any lipo. Just getting back to walking, stretching, stuff like that. Wearing a garment, like a true thigh lipo garment goes past the knees, so that the swelling doesn't stop there, or it looks like a nice like sausage casing from like the ankles all the way up here. But it's not too much recovery time. You can get back to working out within a few weeks and exercising gradually, going back into that. Maintaining results is the same with any type of surgery. You wouldn't like buy a new car and trash it, so you don't want to do that with your body either. You want to do the right things so that you're not getting into a spot where you need another thigh lipo.
Yeah. So. And would you say that for somebody that experiences loss of chafing, for example, right? Because I have patients that have asked me like, I think it's really cute, that little thigh gap, it gives kind of like model vibes. Is that something that is possible of getting with?
It depends on the shape of somebody's legs. So if you have like, you know, bigger legs, and you kind of have to keep the right shape. So you want to keep their shape to begin with. If you have like a little bit of a bulge or something, or you have like thin legs to begin with and you want that thigh gap, then that's probably achievable. But if you have larger legs, or even like athletic legs, you're most likely not going to have a thigh gap, or if you do get one, it's going to look funky. So
yeah, so we always want to go by our body types, you guys, because that's what's going to look best. Okay, so how effective is chin lipo for defining the jawline?
it can be, but again, it depends on the person. If you have like a great jawline to begin with and you just have like, you know, some fat covering it or something, then yeah, but it depends on the structure of your face. Like, I'm never gonna have a super defined jawline. It's not my face shape, you know, like Kim Kardashian or like some of like the stereotypical like Italian jawlines and stuff like that. It's never gonna be me. You know, so it depends on, you know, your individual face structure too, but it's definitely going to help a little bit, you know, to uncover the jawline, and then the lipo like here helps, you know, with the angle, the gonial angle.
And for the chin lipo, how long do you have to wear the garment for?
I ask for 72 hours straight, and then after that, just as much as you can. It's kind of hard unless you're like in a colder state during cold time to, I know, wear it all the time. But if you're home doing nothing or sleeping.
So for how long would you like say, like a month?
I would say a few weeks. You're not gonna get too swollen with the chin lipo. There definitely will be swelling, and it will take, you know, a month for like half the swelling to go away. But it's not anything like huge, like a tummy tuck or lipo the abdomen or anything.
Okay, great. You know, you guys, you heard it there. So if you're struggling with a double chin, all you gotta do is come to us. Dr. Porter right now has a promotion for local anesthesia with chin lipo, you guys, okay? And let's ask her something about that actually. How does it work with the local anesthesia?
Yeah, so there was this solution invented by Dr. Klein to do like a surgeries or liposuction, you know, outpatient. So it's xanthine, lidocaine, epinephrine, and bicarb. And the lidocaine, when you dilute it, you can actually use a lot more than if you're just using straight lidocaine. So we put like regular lidocaine into the areas of incision, and then we put the 2-messin solution in through that, and you sit for like 15 minutes, and then we start the liposuction. So you're nice and numb, but you're totally awake, totally with it.
Amazing, that's great. How long should I wait after liposuction to get J-plasma?
Usually you do them together.
Of course, you guys, we gotta do them together. So if you're already thinking about getting liposuction and you have plans to get J-plasma, you might as well get them together, okay, you guys? So, can Cell Saver be used for all surgeries?
We use it mostly for lipo here because it has to be something that we're collecting the, you know, aspirate in.
Okay. I see here, Dee is asking qué especiales tienen para el Día de las Madres. Hola, ¿cómo estás, linda? Ahorita tenemos especiales muy buenos. Ve para Instagram en nuestro Icon Cosmetic Center página. Vas a ir en Instagram y ahí tenemos especiales espectaculares para el Día de las Madres. También tenemos especiales para la doctora Porter, así que ve y chequea en nuestra página de Instagram, ¿ok? So, now, can slim patients still achieve curvier results even getting like with a skinny BBL, like more petite patients?
Yeah, so where a lot of the curve is going to come from is the liposuction of your back and waist. Almost, if you Google like liposuction triangles, even like very skinny people hold fat in like the area right above your butt. So we can really like clean that area out, and it gives you like more of the curve to your butt. It gives you like the smaller waist, and that's where actually a lot of the curve comes from in a BBL. The fat grafting adds projection, it can add some hips and stuff like that, but like you really have to give yourself time, because once the lipo kicks in like a few months down the road and everything is shrinking, that's when you see the drastic changes.
Amazing. So it's all about patience, you guys. Patience is key. You might not see, the first month you might see, oh, okay, I'm still a little swollen, but we have to remember, I believe it takes around like 3 to 6 months to see your final results, right?
Like 9 months to a year.
9 months to a year, you guys. You see, 9 months to a year, and we have to remember that everybody's body is different as well. So, what is the nipple repositioning process during breast reduction?
So in a lift or a reduction, so in a reduction you create a pedicle because you're removing breast tissue, and based on that pedicle, the nipple stays attached to that pedicle, and you kind of shift it up to where it ideally should be. It stays attached to the breast tissue. And in a lift, there's different ways of doing lifts, but the nipple stays attached, and there's not much breast tissue that is usually taken.
Amazing. Can a breast reduction help with chronic skin irritation under the breast?
Yeah.
Amazing. What compression garments are needed after chin or arm lipo? You already told us about the chin, but what about the arm lipo?
So there's like arm garments. They have like long sleeves, and usually like a crop top, or just like not like a shirt part, but they come in different things, just like the arms. But for 1 month, you wear 24/7, and then for months 2 and 3, 12 hours on, 12 hours off.
Amazing. How do butt reductions work?
So that's kind of getting more common now, as we're seeing less people wanting these drastic BBLs. It's just kind of trying to reshape with liposuction the original BBL.
Of course. So for somebody that received a BBL and with another surgeon, and they would like for it to be smaller, how long would they have to wait?
Like a year, but it's a little difficult because it's not like exactly an easy area to lipo, and there's a lot of risk for like irregularities and stuff. So one, be sure when you're getting like a huge BBL that that's what you want, and two, when you're reducing it, think about if that's actually what you want too, because it's not so easy, and it's probably not going to look like there's high risk for like irregularities.
Of course. So you guys, thank you guys so much for joining this live today. Thank you so much, Dr. Porter, for giving us your time. By the way, you guys, Dr. Porter is accepting free virtual consultations and free in-person consultations. All you need to do, you guys, is leave your information right here in my left bottom corner in this blue folder right here, you guys. Name, phone number, and email. That way we can schedule you right away. Okay, you guys, thank you so much for joining the live today, and stay tuned as we'll be coming back. Bye.